RJ Jane and okay. Hi, this is me, RJ Jane, and this is Dr. Renuka David. A very special conversation indeed, and I'm really looking forward to some extremely interesting insights. First off, Dr. Renuka David, thanks so much for joining us on the Skype call.
Thank you, Jane, for having me. So excited to be here.
All right. So this is a very special video that's a shout out to everybody because Dr. Renuka David has just done a course on COVID-19 from the Harvard Medical School. I was scrolling through my feed. I saw this on my Facebook actually, and I decided, I definitely have to get Dr. Renuka David all the way from Chennai on the Skype call to understand what are the 7 big learnings from her course. Doctor, are you all set in just a bit to do this?
Absolutely, absolutely. I am looking forward, Jane.
All right. Let me just give you a slight introduction to Dr. Renuka David, everybody watching this video. Now, she's a TEDx speaker that makes her absolutely cool, but she does so many other things. And if I look back a little bit into her history, she's been a frontline doctor in the armed forces, which is something that's definitely equipped her with years of experience with respect to wellness and, in general, in the medical field as well. She's been recognized one among the top 100 entrepreneurs by the MSME industry, by the MSME ministry, actually. It was a book that was released by Dr. Nitin Gadkari himself. This is something that's a very high privilege. This one of the top 100 entrepreneurs. She's the MD of the Radiant Medical Services. And every single year, I try and go back to one of the best wellness conclaves that happens across the country with so many big names like Shashi Madhavan, and so many others who've been part of it. A wellness hostess, a TV hostess, active on YouTube as well. Thanks so much, Dr. Renuka, for
Thank
joining.
you, Jane. Thank you. That's such an awesome introduction. Thank you so much.
Absolutely. That's like a very extensive introduction as well, which makes me very, very, happy to have you because I know you're the right person to talk about this. Before we go into the top 7 points, Doctor, how is Chennai right now with respect to COVID-19 at this point in time?
Jane, Chennai is good. We are quite resilient. We are fighting it and we are doing our bit. But sadly, for some reason, we have come up second in the national level. I mean, like infection rate when it comes nationally after Maharashtra, Tamil Nadu in particularly Chennai is being hard hit. Feel really sad about it, but we're just waiting and hoping that the curve would flatten or decline, because I know for some reason the status is just growing. But then the good news is the mortality rate is very low. We're just about 111 this morning, and also the recovery rate is very high. So that's something which we are very hopeful and very happy about. So I'm sure this is just temporary and it is going to pass soon.
Fantastic. So this course that you did, Doctor, let's go straight into it for anybody who's watching this. The fact that you've done this with the Harvard Medical School, it means there's a lot of insights that you've got from this online course. You've done 2 online courses, so let's go straight for it, Doctor. Go.
So, Jane, I would like to start by saying that the COVID situation right now, the problem, it's you cannot categorize this at a problem like as is one size that fits all problems or one size that fits all solutions, because for every individual across the board, the infection and the disease has expressed and manifested in its own way. So I would like to start by saying it's no point saying that, it's generally using it or using it in a generic terms that, oh, this is what we need to do, this is how we need to behave, because it is not as one size that fits all problems or all solutions. So that's the very important takeaway, which I think needs to be told to your audience. The second point that I would like to say is the Harvard Medical School study, it fears that we're going to be in for a second wave of pandemic. And that wave after the COVID wave is going to be the wave of mental illness, mental stress, wherein depression is the biggest factor of the mental illness. We are going to have this problem because there is there is, when you see the statistics, when you see the people around, there appears to be a learned helplessness. People are going down, they're losing lives, they're losing jobs, they're losing loved ones, they're losing everything around them. So it's like a process where they're going into a situation of helplessness, a situation of, oh my God, what's going to happen next? Am I really going to go down? What's going to happen to my family? So it is going to lead to a lot of depression, which manifests in many ways. It's at this point very, very important to recognize what these symptoms are and to control it, because if you recognize it and if you're trying to deal with it, you can prevent it, or you can also reverse the happenings of depression, which could unfortunately lead to suicide. So I think that's something that they're very worried about. And especially when you have someone who's suddenly having this lack of motivation, or they're so stressed out that it's causing insomnia, there is no reason to kind of do anything active, there's a lot of self-pity, there's anxiety, there's fear, there is kind of absolutely and total anxiety, there's all panic
Sorry.
situations.
Yeah.
Yeah, panic situations. So that's something to be very scared of. So that's the second wave of pandemic illness, which is going to be the mental illness. So that's something one has to be mindful for, and one has to prevent it, because it is prevented if you are mindful of this fact. Another
I'm going
thing.
to interrupt you there, doctor. You're talking about mental, faculties and your, in general, your mental wellness being, having taken a backseat. I'm watching this as you're speaking around me. I see a lot of people worried because it is the, COVID-19 disease in itself, but number two, people losing jobs across the country, startups shutting down, big companies, media and startups, and when you look at even IT or banking, a lot of people are firing people across the board. Do you think the ramifications of this COVID-19 pandemic is going to last maybe even a third wave? Is this going to take some time? Because people are genuinely worried right now. And of course,
Yes.
the labor population not being a part of our system anymore for a while. They don't know where they're going to be. Industries are definitely affected. The food and beverage industry, for example. So do you think this has a lot to do with it playing on our minds as well?
So this is something that one has to be very mindful of, Jane, because economy can slowly come back. You can, slowly, step by step, start your livelihood. You can, switch careers. You can still do it if you're okay. You just have to go into that space of resilience where you know that this is a temporary phase. This is passing. I'm strong. I'm going to get over this, and this shall pass, because that's something which, as a health worker, I'm focusing on, I'm working on, because it's something that once you're mentally there, you're mentally strong, you're mentally agile, you're able to reach out, and you're able to touch that core of a person. uh, it's something that I think, whatever is the economic situation that you were talking about, corporates laying off, people losing their jobs, Jane, if you see the Auschwitz survivors, if you see the survivors who have survived the Auschwitz generation of people, have been people who have had immense resilience. They have they've lost everything in their lives, but it's just that mental resilience which have got them through. So that's something that one has to be mindful, one has to be aware of, and one must look out for, because if you're going to address it, and if you're going to open, I'll in fact bring up this point in my fifth point. I'll talk a little more about it. uh, uh, and then the third, what I would like to be talking is about the long time effects on children. Today, Jane, you must realize children are under lockdown. They do not go out. They're not allowed to go out. They're so used to going out and playing in the parks, playing, having this, a team spirit, going to schools, meeting their peers, meeting their teachers. Now, what's happening is they are forced to kind of spend a lot of time in front of the TV, screen time that we call it. So TV, their iPads, their phones, their laptops. So what's happening?
And the classes are online, so
And
everything
the
is
classes are online.
right.
Absolutely.
Yes, right.
Absolutely. So what happens, other than these waves, which we generally as doctors tell them not to be exposed for a long time of time, a long period of time, they also tend to overeat, and there's this lack of exercise. So that's going to definitely have some kind of a repercussion. And also one more thing, Jane, that I would want you to this I would like especially to tell all the parents out there is that parents are also working professionals. They are working from home, so they are under stress. They have to meet deadlines during this lockdown period. So inadvertently, they do not spend that much of time with their children. So as a result, the loneliness just becomes worse for these kids. They are not, they're not there with their friends physically, and then at the same time, the parents are really busy. So this is something which I think if you're just mindful of, I'm sure people will remember that, okay, this is the time I've got to, but I need to spend time with my kids. So time will tell that how they are going to, how the things are panning out. But this is something that long time effects on children's development, because it is also they're missing out on their routine and a structure to their life. The fourth that I would like to give is a tip to healthcare providers, because healthcare providers, Jane, I'm sure you must be seeing in the television, we are reading, we are seeing people around them. They are facing death, they are first facing mortality, morbidity every day. And just wearing those PPEs, wearing those masks, even for half an hour is so uncomfortable. And here they are wearing it 12 to 14 hours. So they are people one has to be watch out, and they have to be kept under monitoring, because yes, it is going to at some point of time tell. So, and then also they've got to listen, because there are a lot of people who are going to come and talk to them. They're going to say that, doctor, what do I do? I'm losing my job, I'm this and that. When they're out and they're facing these problems, how do they deal with this? So my little tip for them is that it's okay, because you're a doctor. At the end of the day, you're a nurse, you're a doctor. People will come and talk to you. They will like to come, but don't treat them as people who have got mental problems or people who have got mental stress. They are people who are going through economic problems, and they just need some professional to tell them it's going to be okay. It's going to be. So as healthcare providers, it's necessary for them to listen, and at the same time not being judgmental. That so the one thing is that what Dr. Lakshmi Vijayakumar, the Sneha founder, was telling me the other day was that when a patient is depressed, they just need someone to listen. And what we do as healthcare providers, or even as a friend, as a parent, as a sibling, we immediately tell that person that, hey, two things we say. We say, look at your condition, see how you're staying, look at the house you're staying in, and all, and see, compare it to somebody else. You're so much better off. Or secondly, you say that, okay, you're really hard pressed, you need to have a break. So this is some things which is not to be told to a mentally depressed person, especially a healthcare professional, that person should be very mindful of. You should just kind of, coming back to your earlier problem when we were dealing with this kind of stress, he should actually tell them that, get him into that space where he's able to build his resilience, where he's able to build his confidence. Maybe if that person is insomniac, just tell him, why don't you sleep, get that 8 hours of sleep, because if you're going to sleep, you're going to get up fresh. Maybe you can rewrite your resume. Maybe this work is not for you. Maybe you can try something else. It is important to just go there and build someone's resilience at this point of time. So that would be my tip for especially for healthcare professionals and for physicians and nurses, where patients reach out to them. And definitely the if it's beyond them, they should be able to boldly refer these patients to a psychiatrist or to a health professional, a professional health mental health worker who can deal with these problems. So he should not hesitate to refer immediately such patients. So there has to be an open-mindedness in this. Now the tips for this general, like a person who is as a lay person or as a friend. Now, how can you see? Now, you just told me that, doctor, there are so many people, my friends, who are having problems. They're being laid off in their companies and their restaurants and this and that. Yes, it is a situation. It is a very difficult situation for, I think, everybody. Everyone have lost something in this, if not a life, if not your livelihood, but in some way you have been affected. So it's no point actually saying that, oh, we are all, I understand this, we are all in this together. But it's not necessary that you can understand the pain someone has faced when they've lost their livelihood. They don't even know if they're going to live in the same house, or whether they're going to go back to work the next day, or whether they're going to get their salary, or whether they are even going to be able to provide food and shelter for their loved ones. So you don't know what that person is passing through. So at this point of time, I think one just have to be empathetic, just try to do whatever little bit you can do. It could be even today you hear so much about the migrant workers, and even reaching out in any kind of way. I think, Jane, the most important is just to be a patient hearer, to be a listener without being judgmental. I think that's something that one can do. And as I repeatedly said, just try to build up the resilience. Do not wallow, or go, oh yeah, I can understand you are in a you are in a bad condition, and I hate to be in your space, and poor you. And that's the last thing I think you should be doing, because as I said, all of us,
I guess, misery loves company. And the one way to actually get out of the situation, even if you're feeling a little bit of that, the pain or the loss, is just to somehow overcome it and replace it with some sort of a joy, right? Because that's the only way you can empathize and be there for somebody and turn this situation around into something positive, right? So that's
absolutely.
I think that's a very important call out, right?
Absolutely, absolutely. And then my sixth point would be, Jane, that we have read, comorbid, features with a patient. If they if they get COVID-19, it could be very, very bad for them. But yes, that is 100% true. But then that also you should be mindful of the fact that it's not only physically but mentally also. A person who has got the comorbidity factors like a diabetes or a hypertension or a coronary vascular disease or cancer, one is his immunity levels are less. So yes, he's more susceptible to get the virus. He's more susceptible because viruses are opportunistic beings which actually dwell in everyone's body. They come up when your immunity comes down, or when for some of these reasons you get the symptoms of a viral attack. Corona is not less different. It's only that the strain is right now, as you know, it is a very virulent strain which is attacking, and it is causing mortality and morbidity. But other than that, people who do have this, and they undergo any kind of depression, mental stress in the form of depression, that is really, really dangerous, because the Harvard Medical School also says that it is actually, there is a relationship. There is, if I could read the correct word, they say that there is a bi-directional relationship between depression and diabetes and coronary vascular disease. So it is, they have oxidative stress, which is pathophysiological factors affecting a diabetic patient. And that can be very, very bad for a person, because a person who has diabetes and he goes under this depression, and, there's the high probability that his blood sugar will shoot up. And Jane, you must have also read about incidences where suddenly people are having myocardial infarction and dying. I mean, they're okay, and then the next morning, they've gone. They just die in their sleep. Because there is anxiety, right? There's a lot of anxiety. And if you have these comorbidity factors, stress directly, it kind of worsens your situation. So
So
it's
you're
not
saying
just...
that whether you are COVID-19 positive or otherwise, in such a situation like this during a pandemic, keep the stress as much as possible away, because that is when it can combine with any other underlying conditions, which is what, I mean, we've been reading. So now I
Yes,
understand that this depression accelerates it, and thereby we need to stay away, especially people with underlying conditions, need to be a lot more careful about depression not coming into their lives, right? Because then it
absolutely.
affects them straight away. And does
Yes.
it complicate it further when you're a COVID-19 positive patient?
It does. It does, because COVID-19, it's bad for them, because it kind of, if you see the physiological of how pathogenicity of how this virus attacks, it does attack it starts from the lungs, and then it is a multi-organ system which it attacks, and then you slowly go down, and it reacts with the surfactant factors of your lung tissue. And so you need a lot of immunity, you need a lot of resistance to kind of fight this disease. So yes, if you have these comorbid factors, it kind of doesn't, it puts you down a couple of disadvantages than a regular person to fight this illness. So even nowadays, a lot of people say build your immunity, have vitamin C, have vitamin E, have a lot of iron, selenium in your diet, because these are minerals and these are vitamins which can help to boost your immunity. So that's very true.
Are there any foods that you would recommend, doctor, since you're saying selenium and vitamin C and E? Or should we have supplements? Because our diet these days, most of the time right now, does not cover all of this. So what would you recommend here?
Yes, that's a very, very good question, Jane. Right now, it's a very good question because we are scared to eat vegetables from outside because in Chennai, there's the Coimbatore market, which is one of the hotspots, which is responsible for this sudden spike in the number of coronavirus in and around Chennai, and people have stopped buying vegetables. I, for one, when I buy vegetables, I soak them in baking soda for at least half an hour, wash them, and then I dry them and use them. But it's good to not use vegetables for some time till at least you know that you're sure that the source of the vegetables is good. But at this point of time, it's good to supplement. So have vitamin C. It's good to have vitamin C tablets every day. It's good to have a multivitamin which has
That's
magnesium,
all the
selenium. Yeah,
yes
yes.
components.
So it
Right.
has all that. It is good to have this. You can actually have if you're not your body is good, you're healthy, you can even have 2 tablets a day because it's a temporary. You can have it maybe for about 2 months, and then slowly, once you are able to have your fresh citrus fruit and you're able to have your go back to your your normal diet, then you can kind of reduce it and phase it out. But then yes, it is good to supplement at this point of time. Yeah,
All right.
yeah.
This is
And
something.
yeah,
Which point are we on, doctor, right now? Point number
we are we are
five,
doing we are in point number 6.
six
Yeah,
now.
so
Damn.
there's yeah, so that's something which one has to be mindful of. And the New England Journal of Medicine has also said that the rate of hospitalization during these days has pummeled. The reason for this is what is happening is a lot of patients are scared to go to hospital. So there are patients, the statistics says that there are patients who are having coronary vascular diseases like a myocardial infarction or a stroke, and they are suffering at home. They just confuse it with the symptoms of something else, and they just do not want to go to the hospital for the fear of COVID-19. So it will not be surprising when these guys go back to the hospital and the doctor says, hey, this murmur wasn't there, but how have you just developed a murmur? Or the what is the stick in your face? Why is your muscles twitching? So that's something which I think over a time it's a factor to be mindful of, because a lot of people are scared to go to hospitals these days. So, and it's
So basically, if there are other issues, then you're just not going to the hospital and you're making it worse. And ultimately, when you have to go back, it just is that your physical condition has deteriorated. So you're just saying whatever the issue is, do go to a GP or do go to your hospital for whatever problem you have. But I have heard, and this is like a counter question. Somebody was telling me, a friend, her friend's father has cancer, and now the beds in all hospitals have become more expensive for even non-COVID treatments. Is this something that you're seeing across the board overall?
I have been following this, Jane, and though there are a lot of hospitals who are providing COVID beds and they are keeping a segment of the hospital open for COVID, but I'm not too sure about whether they're overcharging their patients, because the truth actually never comes out unless you go and get admitted yourself. They
Sure.
say that they do not, but yes, there are studies showing that there is an increase in rates for these, and then the civil hospitals have to work in tandem with the government hospitals because we need beds at this point of time. And for that, for the period of for the time that you are convalescent, you need spaces. So schools and things are being converted. But having said this, I think hospital admission at this point of time, unless it is necessary and avoidable, it's yes. But then I will not encourage people to stay at home if they have an illness. Today there's a lot of things happening in telemedicine. there is online consultations, there is Zoom appointments. So please do that. Get in touch with your physician, get in touch with you. And then nowadays, even through telemedicine, you can also share your reports. So in case you have a problem and you are not comfortable about your situation, I think you should consult your doctor immediately and then go to a hospital if the doctor advises you to come. It's no point staying at home and taking a risk because, as you said, it could just get worse. So
Absolutely. So these are some of the, learnings that you've had. How long was this course, doctor, and how positive are you about the way ahead? Like many people are saying, season 2 of 2020 better be better because June is almost here. What are your thoughts right now? Because at this point in time, there's so much of fear and paranoia. And like you said, if we continue down that path, it's just going to not take us to the right direction. Any tips on the path ahead, whatever is left of this year?
yes, yes, Jane, absolutely. It is utmost importance for all of us to follow the social protocols that have our government has told us, our state government, our central government, which, as we all know, is wearing the mask, sanitizing your hands periodically, and then maintaining that social distance. And about the mask, also, what I would recommend is right now you could even do a cloth mask, which you can make at home, or it's much more comfortable because you can wash it every day. And I would advise after the 15th or 16th wash, just discard it and get another mask for yourself. That's very important. The reusable masks, as much as possible, if you're using it, use it and then try to sterilize it. You must be knowing 60-degree temperature. You've got to rinse it out with that and then rinse it for 30 minutes and then use it. But again, just for 3 or 4 days because that doesn't last. And right now, one has learned to know this 2.5 months has taught me to pause, to take a pause and realize that it has taught me so much about my needs. I'm surprised at my needs because I keep learning about myself. This pause, I think, was necessary for me. And I'm hoping to continue to follow this even once all this is over because I guess the new normal, which is recognized by us, should remain as part of our lifestyle all our lives. And my heart actually goes out to a lot of people, the migrant laborers, yes, but right now with all this locust issue that is damaging all these crops
Yeah,
across
yeah,
Punjab and Rajasthan, there is so much of sadness, so much of livelihood loss. It's just that I think, Jane, we have to be responsible. We have to be empathetic. We have to be giving. We have to, I would like to actually end my thought by a little story that I just read recently.
sure.
There was a school teacher who uh, told her students to write their names in a balloon. She gave each of them a balloon and told them to write their names. And then she just left the balloons on the ground and she mixed them and just left it. And she told the students, all you've got to do is go around, search for your balloon and burst it. And let's see who does it first. Whoever does it can come and stand there and get your prize. And then the children took forever to find their balloons to burst it. Finally, she said, okay, now all you have to do is take the balloon which is nearest to you, see who the owner of that balloon is, and just go and give it to that person by hand. And when she did this exercise, within 2-3 minutes, everyone had their balloons in their
He had
hand.
their in their hand. So
Yes.
this story is very, very, it's very, very apt because at this point in time, humanity has to come together. It's a team effort. We all have to help each other. And I'm seeing this across the city of Bangalore, across the various other cities. When I see this on the internet, when I see people actually reaching out, whether it's to help feed the migrant labor or whatever little bit that they can do to spread the positivity amidst their circles. Right now, we need to be in this together. And I think the biggest shout out is to stay positive. It's difficult with all the overbearing circumstances, but you're saying, let's just come together and keep that smile and support and empathize, right?
Yes, Jane, absolutely. That's the message, and yeah, that's what we have to be.
We have exactly another 1.5 minutes to finish this session. So, this is the question I'm sure you get asked, and maybe you don't have answers. Most people right now, even in the medical fraternity, do not have the answers. When do you think will there be a cure or a vaccine? Because there's, so many versions of this virus now. So, your final shout out on that, if you can, if you have an idea on when this is going to play out. for all
Jane,
of you?
that's a very very nice, valid question. A question that most of us would love to have the answers. Where it is just a black and white answer that okay, on this day we're having our vaccine, we've got to tolerate it for so many months, and on this day we're all going to be free. Unfortunately, none of us have that answer. The vaccine does look that it's going to take some time. It would be a couple of months, maybe beginning of next year or mid of next year, we'll have the vaccine. Until then, we have to learn to live with the virus. We have to live a new normal. We should not panic. We should not get scared. We shouldn't let anxiety bog us down. We've got to just maintain all the right protocols, and we have to kind of overcome this because, as I said, Jane, this is temporary. This will also pass. Unfortunately, it's taken a very heavy toll to not only my state, my country, or to the world. A lot of people have lost their lives. A lot of people have lost their livelihoods, and the world will slowly skip back into its the pre-COVID days. So until then, I guess it's something that unfortunately I would not have an answer of when the vaccine is when, but we just have to live with the new normal responsibly and being as empathetic and as giving as possible. I mean, just trying to reach out and do your best, better than your best for your community.
Thank you very much, Doctor. That's all that we have time for in this session. We've reached the 30-minute mark. Thank you very much. Everybody stay positive. Dr. Renuka David, thank you very much for joining us. It's been an absolute pleasure. I'm sure this is going to give a lot of people reasons to just smile, keep going on, and keep the hope alive. Thank you very much, Doctor.
It's lovely being with you, Jane. Thank you for having me, and have a great week ahead, Jane. Thank you so much.
Thank you very much. 2020 season 2 and the rest of it, I'm sure is going to be better. Thank you very much, Dr. Renuka. Have a fabulous year ahead, and do keep us updated on any of the latest developments that come in. Thank you very much.
Thank you, Jane.
Doctor, I'm going to do one thing. I'm just going to stop recording.